Hello, welcome to this video. This is our members. Today we will explain the topic related to internal consideration affecting pricing strategies in medical industries, hospital/clinic/pharmacy. Internal factors are of a key role when considering pricing strategies in the healthcare sector, including hospitals, clinics, and pharmacies. These considerations are impacted by a multitude of elements that are unique to the organization and its operating setting. In this analysis, we will explore some significant internal elements that influence pricing methods inside healthcare settings. The comprehension of an organization's cost structure is essential in the establishment
of pricing strategies. Hospitals, clinics, and pharmacies are required to take into account various operating expenditures, including but not limited to personnel remuneration, facility upkeep, acquisition of medical equipment, and pharmaceutical procurement prices. Conducting a thorough cost analysis is essential in order to ascertain the minimal price threshold necessary to sufficiently pay these expenses. Besides, profit margin objectives such as the profit margin objectives of healthcare entities might vary depending on factors such as their purpose, ownership structure, non-profit or for-profit, and long-term sustainability goals. Non-profit hospitals, for instance, may place a higher emphasis on delivering accessible healthcare services at cheap rates rather than only focusing on profit maximization. Next, market position, which is internal considerations, should include an evaluation of the organization's standing within the local healthcare market. Does the company own a prominent position as a supplier with a well-established brand reputation, or is it operating within a highly competitive market? The alignment of pricing plans with an organization's market position and competitive advantages is crucial. Furthermore, the service portfolio of healthcare institutions encompasses a diverse array of services and goods, including those provided by hospitals, clinics, and pharmacies. When formulating pricing strategies, it is essential to take into account the composition of services provided, their respective contribution margins, and the extent to which they mutually enhance one another. Pharmacies may use the strategy of offering affordable prescription medications in order to entice consumers who are more likely to also buy higher profit over-the-counter items. Moreover, the establishment of well-defined price targets is crucial. Hospitals use various financial strategies such as implementing price structures that aim to achieve cost recovery, cross-subsidizing certain services, or creating surplus funds for reinvestment purposes. Clinics and pharmacies have the option to place emphasis on patient affordability or competitive pricing within certain medicine categories. The healthcare sector is subject to extensive regulatory oversight, necessitating adherence to pricing methods that align with rules at the local, state, and federal levels. It is of utmost importance to comprehend the legal framework and guarantee that pricing practices are in strict adherence to these requirements. Hospitals and clinics often depend on several reimbursement methods, such as fee-for-service, capitation, and bundled payments, to get compensation for their services. These models have the potential to have a substantial influence on pricing strategies, since they play a crucial role in determining the payment mechanisms for healthcare services. In summary, the pricing tactics used in hospitals, clinics, and pharmacies are subject to the complex interaction of several internal elements. The aforementioned factors need meticulous examination, strategic formulation, and adjustment to guarantee the organization's ability to provide high-quality healthcare, maintain financial sustainability, and address the demands of both patients and the wider healthcare industry.
The medical industry in Malaysia. Malaysia is making waves in healthcare and pharmaceuticals. It's a top destination for medical tourists in Southeast Asia, with over 1 million visitors in 2019, generating $433 million in revenue, up from 640,000 visitors in 2011. This growth is supported by the Malaysia Healthcare Travel Council (MHTC). The pharmaceutical industry in Malaysia is valued at over $1 billion in 2019, driven by health awareness, an aging population, and non-communicable diseases. However, local generic manufacturers meet only 30% of demand, importing the rest. Malaysia leads in the halal pharmaceutical market, projected to be worth $174 billion by 2025. Companies like Chemical Company of Malaysia, CCM, Berhad have earned halal certification for prescription medicines, showing Malaysia's commitment to excellence.
Determining fees in the medical industry is an intricate endeavor driven by a variety of internal factors. These factors can differ based on the industry category, such as medicines, healthcare services, medical equipment, or insurance.
3.1 Organizational policies.
Organizational policies serve as guides for decision-making. Pricing regulations vary from one organization to the other. Through its price practices, a company may seek a certain public image. Price policies are internal elements that have an impact on price. The pricing approach also reflects the organization's ultimate goal.
3.2 Service differentiation.
The nature of services is intangible. When the heart of the services is uniform, the service provider seeks to differentiate his service from that of his competition. Pricing is used to distinguish services. This differential assists clients in determining the value of the services they receive. Distinctiveness gives value to services and achieves brand distinctiveness. The brand will become the primary differentiator, and customer decisions will be influenced less by an assessment of functional advantages.
3.3 Service cost.
The medical industry must be aware of the expenses associated with delivering services. They should determine the fixed and variable costs related to medical supply. Furthermore, semi-variable prices display erratic behavior. Fixed costs are not affected by the output level and stay constant throughout time. The quantity of medical delivered determines variable expenses. Variable expenses include part-time worker compensation and other utilities such as consumable materials, power, and mail. Some costs have parts that are both fixed and variable. Semi-variable expenses include telephone charges, paid personnel for overtime work, etc.
3.4 Marketing mix.
The marketing mix is a conglomeration of many submixes of the marketing mix. They are as follows: product mix, promotion mix, pricing mix, and place mix. People, tangible proof, and procedures have been added to the marketing mix as submixes. The nature of the medical idea, whether fresh or existing, influences the medical pricing.
By offering major healthcare services, the medical sector, which consists of hospitals, private clinics, and pharmacies, plays a crucial role in society. However, the cost of production is an internal factor that is sometimes overlooked in spite of the focus on patient care, technical developments, and regulatory compliance. The neglect of cost of production. Number 1. The impact on the quality of care. Healthcare facilities' ability to provide high-quality care can be directly impacted by production cost neglect. It can be difficult to detect and effectively manage attrition because healthcare services have many aspects and include a variety of specialists and departments. There are several factors contribute to the attrition of healthcare professionals in the medical industry. First is burnout. Burnout occurs as a result of the long-lasting, high-stress labor that healthcare professionals frequently perform. Early retirement, or a change to less demanding employment are possible outcomes of this.
The path to bringing a new drug to market and research and development is a complex journey that directly affects its price. This process involves extensive research and development, R&D, efforts, regulatory evaluations, and substantial risks. It typically spans 10 to 20 years.
1. Cost structure. Understanding the internal cost structure of healthcare facilities is crucial. Hospitals have high overhead costs, while clinics and pharmacies may have low operational expenses. Pricing strategies should align with these cost structures to ensure profitability. 2. Revenue goals. Each healthcare facility may have different revenue goals based on their mission and objectives. Hospitals might prioritize overall patient care, while pharmacies aim for profitability. Pricing strategies must support these revenue targets.
3. Competitive position. Healthcare facilities need to assess their competitive position in the market. Hospitals may differentiate based on specialized services, while clinics and pharmacies may focus on convenience. Pricing should reflect this positioning.
Here are comprehensive and general conclusions on internal factors influencing pricing strategies in these healthcare settings, such as quality of care and patient outcomes. To focus on the caliber of care and patient outcomes should be included in internal considerations as well. To guarantee that patients receive value for the services rendered, pricing should be coordinated with quality initiatives. Pricing decisions should be made in accordance with the organization's strategic goals and mission. For instance, a nonprofit organization with a clear mission might put accessibility and affordability first, while for-profit businesses might put profitability first. Clinical protocols and guidelines. Which are clinical protocols and guidelines may establish the accepted level of care, which may have an impact on pricing. Pricing should reflect adherence to these standards, and it is crucial to follow best practices. In conclusion, pricing strategies in medical facilities such as hospitals, clinics, and pharmacies are intricate and multifaceted, influenced by a variety of internal factors. To meet the organization's financial objectives, deliver high-quality care, and maintain competitiveness in the healthcare sector, these factors must be carefully weighed and balanced. As the healthcare landscape continues to change, pricing strategies must be flexible and adaptable.